prevailing on. This is the case study about CIN. Nearly a 56 years old man, he's a teacher, it is suffering from, suddenly he is suffering from fetal edema, then it is failure, less urine output, no urine output or decreased urine output, then tiredness, correct, and by the evening he may feel swelling of lower abdomen also, okay. The patient may feel the patient subjected to the hospital immediately. They are going to done these things at all. Come, let's discuss about what are the things they done. Here, a sudden decrease in kidney function
after administration of contrast.
Okay.
It's increase in serum creatinine by greater than 0.5.
While biochemistry test will indicate the biochemistry test also done for the patient at the time of the administered. It is suffering from increased level of creatinine, right? Creatinine level get increased and urea also. Why this happened is, before a week, he is admitted to the hospital for the procedure of CAG. That time the contrast will injected to the patients for diagnostic the cardiovascular disease, coronary artery disease. So it does mainly leads to some contraindications like contrast-induced nephropathy. Here, the things are
It increases within 48 to 72 hours.
okay. So here the pathophysiology for CAN are
Vasoconstrictions,
necrosis. Okay.
It affects renal tubular cells. It decreases absorption and excretion of water and electrolytes. Inflammation, then oxidative stress, increase the oxygen and decrease in kidney functions.
Once the vasoconstriction will happen means it affects the renal tubular cells, because renal tubular cells it is majorly important for absorption, electrolytes, water and aminoproteins, what and all that. So absorption and excretion also get affected, unevenly will happen. Then inflammation, which means a cooling of water retentions and not happening. So it is inflammation will be present either in or abdominal side areas also. Then it make to oxidative stress. Next, risk factors are
dehydration,
okay,
diabetes,
insipidus, okay,
uses of electrotoxic drugs.
We doesn't use the nephropathic drugs.
We are going to symptoms such as nausea, vomiting,
Dysphagia.
low urine output, and
Okay.
cause edema. Its severely causes pulmonary edema.
Okay. Pedal edema and also pulmonary edema, fluid retention and all that. Okay. Then treatment of
Fluid management.
fluid management.
Nephrotoxic stop, nephrotoxic drugs.
Nephrotoxic drugs.
Then control BP, then electrolyte imbalance.
See, once the kidney get affected means, correct, nephrology get affected means which irregularity BP, correct. Control system will happening here also, chemothorax and also bioreceptors like acetylcholine system. So it also disturb the pressure, make hypertension for the patients.
Prevention. Patient should hydration and use low osmolar contrast and small amount of doses. Stop nephrotoxic drugs such as diuretics, NSAIDs, ACE.
Okay, then special investigation anything done? No. Okay, that is all about contrast-induced nephropathy now. So here we having two types of contrast agents here. One is an iodexanol and another one is an iohexanol. Both are low osmolar contrast. Yes. What is osmolarity and low osmolar contrast here?
Contrast is depending on osmolarity. Osmolarity is the high osmolar, low osmolar, and isoosmolar. High osmolar is the high risk of toxicity,
Okay.
and it affects kidney. And low osmolar is a non-ionic one.
It does not affect the kidney. also normal range within 2 or more than 0.5 levels. No need to use for more reactive and reactive agents when creatinine level is about 3 and above. Okay, correct. It is water soluble and non-ionic one thing, correct. And this is also one iodexanol, also water soluble and non-ionic one. So that is all about contrast induced nephropathy. Here we covered about patient conditions. What are the symptoms they feel like? Pedal edema, breathlessness, decreased urine output, and also insipidus change symptoms also they having now. Then risk factors also we have discussed now. And what about the treatment now? Fluid management,
blood pressure control,
okay,
and electrolyte imbalance.
Okay, electrolyte imbalance. Then prevention is about hydration, low osmolar contrast, usage of low osmolar contrast, and dietary. It has been investigated using major thing. One is the creatinine level checking, then normal vital checkup about pressure and cardiogram checkups. Thank you all.